In this last Insight lecture, we're going to cover the remainder of the radiological testing techniques you should be familiar with as you continue to learn the language of radiology. The techniques which you have learned so far, while numerous, hopefully have been a little more digestible given over 4 parts instead of one large lecture. Let's continue. Ultrasonography, based on sound waves and not radiation, is one of the most commonly used radiographic techniques. It's easily accessible and relatively inexpensive. Today's ultrasound machines range from large hospital units to smaller units that can be carried in a medical student's pocket. For example, look at General Electric's V-Scan unit. Ultrasonography, because of its safety, ease of use, relative inexpensiveness, and of course portability, is used to image almost every part of the body. Here in the upper left corner, we see a handheld portable ultrasound unit manufactured by General Electric. Ultrasound, along with Doppler imaging, which measures blood flow in the blood vessels, can be used to assess for disease in blood vessels such as narrowing, also known as stenosis, plaque formation, atherosclerosis, or even fistulas, an abnormal communication between an artery and a vein. In the center image, the technologist is performing an abdominal ultrasound on a patient. Please keep your anatomy atlas handy. You're going to need it. Remember, in this presentation, the transcript can be found under the paperclip icon, along with the PowerPoint slides if you'd like to download them. Furthermore, you'll soon notice I often use links to YouTube videos because it's much easier than embedding an entire video. Doing this makes for a smaller presentation, and experience has taught me PowerPoint does not play well with embedded videos. Please take advantage of these links and watch these YouTube videos. I've reviewed them and I think they're important. Here in this slide, we can see an ultrasound of the liver and the kidney. The image in the upper left shows how the ultrasound beam passes through the liver and images not only the liver but the kidney. In the area below the liver, but above the kidney, we can see a space called Morrison's pouch. Fluid can collect here. It can be normal or abnormal depending on how much fluid collects here and what the clinical presentation of the patient is like. 2 of the 3 images clearly show fluid beneath the liver and above the kidney in Morrison's pouch. It's probably normal physiologic amounts of fluid. Ultrasound is usually performed external to the body, through the skin, and can also be performed intraoperatively into a variety of anatomical cavities, for example, the thorax, the abdomen, or the pelvis. Here we can see an intraoperative ultrasound probe used to assess whether there are gallstones in the gallbladder and or the common bile duct. The middle lower image shows gallstones within the gallbladder. Notice how the ultrasound beam causes a shadow as it passes through the gallstones. The relevant anatomy is reviewed in the image located in the upper left. Interestingly, intraoperative ultrasound and radiofrequency techniques can also be used not only to find tumors, but to ablate them intraoperatively. The technology is almost endless for ultrasound. In addition to ultrasonography being performed externally, as we just saw, internally looking at the bile ducts, it can also be used in the pelvis. The images in the upper left show a procedure called pelviscopy. This is an operative procedure where laparoscopic instruments are placed into the pelvis. In this patient, who's had a hysterectomy or removal of the uterus, we can see the sigmoid colon and what's left of the fallopian tubes and ovaries. I've labeled these structures for you. The image in the upper right shows a transvaginal ultrasound being performed. The image in the lower right shows the relevant anatomy. This is a sagittal view of the uterus, showing us the endometrium of the uterus, the myometrium of the uterus, i.e. the muscular portion of the wall of the uterus, and the entire uterus proper. The image on the lower left shows urine in the urinary bladder. Again, we can see the endometrial lining in the myometrium, and they have outlined the uterus for us to visualize. Thus, in slide number 5 and slide number 4, we've seen how ultrasound is used to visualize the liver and the right kidney, the gallbladder, Morrison's pouch, and we've reviewed a transvaginal image of the uterus as well as intraoperative placement of an ultrasound probe to assess the bile ducts and the organs of the pelvis. Another way ultrasound can be used is to assess cardiac function. Transthoracic ultrasonography of the heart, called echocardiography, is not as sensitive as is transesophageal echocardiography. This picture shows a patient under sedation with an endoscope that's been fitted with an ultrasound unit at the tip, being placed into the distal esophagus to view the cardiac valves. This is the best and most accurate way to assess the cardiac valves, except for maybe cardiac angiography, which is much more invasive and has the possibility for more complications. Transesophageal echocardiography is more invasive than transthoracic external echocardiography. If I want to look at a patient's heart valves, we've already learned that there are several ways to do it. One, I can auscultate the heart with a stethoscope, which will give me an audio view of cardiac valvular function by listening for murmurs. Number 2, I can perform a transthoracic echocardiography through the skin of the chest. Or number 3, transesophageal echocardiography, or coronary angiography, or maybe even 5, a CT MRI angiogram, i.e. MR angio or CT angio. However, the best images will be obtained through transesophageal echocardiography. It goes without saying, we know what's supposed to be in this package. Today, ultrasonography generates a 3D image, and for marketing reasons, to sell these ultrasound units to physicians, it's termed 4D ultrasound. The 3 dimensions of the X, Y, and Z axes, with time being the 4th dimension. We believe transabdominal and pelvic ultrasonography to be safe during pregnancy, but some clinicians have attempted to link it to autism. The data is statistically insignificant and does not support this claim. However, always keep in mind, any imaging technique has risk. 2 radiographic studies which require the injection of a radioactive isotope, usually technetium, are the bone scan and IDO scan respectively. In this slide, we see a patient who is having a bone scan performed. The patient has been injected with the radioactive isotope and is sitting under a gamma camera. The gamma camera is a high-tech Geiger counter, which measures radioactivity levels and converts those detected radiation levels into an image. The picture obtained is shown on the right. The most important aspect of interpreting an image from a bone scan is to look for symmetry. If there are any abnormally generated areas of high intensity, shown by the black marks, that may be unilateral on one side, these raise suspicion for underlying disease such as metastatic cancer, trauma, fractures, even arthritis. This patient has symmetric lesions, and his findings are most consistent with a normal bone scan, probably with arthritis in each of the respective joints. Here we have a IDO scan, also known as cholescintigraphy, and previously known as a Mechel scan. You'll learn later what the initials stand for, but for now, just understand this is a radioactive test, much like the bone scan, where the patient is injected with technetium, and using a gamma camera, images are obtained. In this image on the left only for comparison purposes, I've given you an upper GI series showing the relevant anatomy, the stomach, the duodenum, and the intestines, the small intestines. On the right is a normal IDO scan. Here you can see the liver, the gallbladder, the common bile duct, the small intestine, the mesentery, and a small amount of bilious reflux back into the stomach. If the patient has gallbladder disease, the gallbladder will not be seen at all, or it'll be seen after a delayed amount of time has gone by, usually hours. Normally the gallbladder, if it's normal, will light up in about 10 minutes. Another radioactive radiological examination is called a Mechel Scan. In embryology, you'll learn what a Mechel's diverticulum is and its embryological congenital origins. Here's a photo of a Mechel's diverticulum and a graphic representation of this embryological abnormality. A Mechel's diverticulum can wreak havoc in childhood and even adulthood. Complications of a Mechel's diverticulum include bowel obstructions, bleeding, volvulus, known as twisting of bowel, or a volvulus even around the Mechel's diverticulum, and it can, but doesn't have to, contain two types of tissue found in other areas of the body. We call such tissue, which doesn't belong where it's found, ectopic tissue. Notably, a Mechel's diverticulum can contain gastric mucosa and mucosa from the pancreas, pancreatic mucosa. If a patient has a Mechel's diverticulum, and we may have no way of knowing if they do, they may suffer massive gastrointestinal bleeding from the diverticulum. For definition, a diverticulum is just a pouch, and a diverticulum can occur anywhere in the GI tract. These pouches can occur in the esophagus, the small intestine, the jejunum, the ileum, pretty much anywhere, and they can occur in the colon. But a Mechel's is a name for a very specific pouch, occurring in the small bowel, 2 feet proximal to the ileocecal valve, about 2 inches in size, that contains two types of mucosa, parentheses, usually in parentheses. A Mechel scan allows the physician to localize the Mechel's diverticulum and assess whether it is present and bleeding or not. Let's take a look at another test that relies on radioactive material. This time it's glucose, not technetium. A PET scan is a relatively new radiological intervention. It's been around for about 20 years. A PET scan is based on an injection of radioactive glucose with the theory cancer has a higher metabolic rate than the surrounding tissues, and the cancer will uptake glucose faster than the surrounding tissues. When or if it does, we can image for the radioactive glucose using a positron emission tomography scanner, i.e. a PET scanner. The image on the left is normal. The image on the right is abnormal. We see the CT scan in sagittal view in the image on the right, the PET scan in sagittal view with an abnormality in the mid-thoracic region, and finally the fusion of the two images, which clearly shows us there is a metastatic lesion in one of the patient's ribs. The darker spot in the lower pelvis is urine, which has been excreted but contains radioactive glucose. Interestingly, glucose in the urine raises the possibility that this patient may have underlying diabetes. However, if the patient is given such a huge load of radioactive glucose, the body, of course, during the scanning time, won't be able to use all of that glucose, and by default, it has to be excreted somehow. Be careful interpreting this as diabetes because it could just be a normal finding of the massive glucose load the patient was given to try to find any metastatic lesions. Thermography has an interesting history. Thermography is often used by building maintenance supervisors and construction contractors to look for loss of heat energy from a building structure. Thermography has no role in current medical practice today, for any reason. The science is sound, and the practical applications of the thermoscope are also sound. However, thermography used to detect breast cancer simply does not work unless the cancer is massive, and by then you only need your eyeballs to see the cancer and you won't need a thermogram. Remember, you learned about 2D and 3D mammography earlier and how the detection of a small breast cancer of about 1 millimeter or so in size can be seen on a mammogram. This is not true of thermography. You should never order a thermogram on your patient if you're looking for breast cancer. Thermography is based on changes of blood flow and loss or gain of heat, with the cooler areas appearing blue while the warmer areas appear red. As you can see, the resolution isn't good enough to show you a 1 millimeter breast cancer. Now we move into the very high-tech areas of radiation oncology and radiation physics. Two types of radiation can be used to treat cancer. These are not per se imaging modalities, but are rather treatments. Gamma knife therapy uses focused beams of radiation to treat cancer. The patient's head or body must be fixed in a metal cage to prevent movement, or the skin is tattooed, so the beam is aimed at the exact same spot with each and every treatment. Occasionally, you may run into these patients who have tattoos on their forehead or on the sides of their head or any areas of their body. These patients are receiving some sort of gamma knife therapy. The image on the right shows proton therapy and a link to how proton therapy works, as well as other links showing how gamma knife therapy works from the patient's perspective. Proton therapy is currently the most expensive medical treatment in the United States. It's based on years of research and the application of protons, not neutrons or X-rays, to treat intracranial neoplasms as well as other neoplasms. The patient must have a special individually fitted headgear before treatment can begin. Because of the characteristics of proton therapy and the physics of proton movement in a magnetic field, it allows a beam of protons to enter at an exact depth without damaging surrounding tissues. Such is not necessarily true of gamma knife treatments, although over the years they have improved. Now let's look at an actual clinical use of radiological imaging in a patient who has a metastatic skin cancer to the brain, in this case, malignant melanoma of the skin that has spread to the brain. Here we see two MRI images showing the metastatic melanoma, which is seen as the large, bright white spot about the size of a walnut on these MRI images. If you click the link, you can watch the neurosurgeon remove the metastatic melanoma from the brain tissue. The neurosurgeon transects the dura mater of the brain, exposes the brain, and then uses fine pointed electrocautery forceps, known as bipolar cautery, to exactly cauterize the blue tissue and not the surrounding brain. As you would expect, a melanoma is blue in color because it contains melanin. This is a clinical example of how imaging, using MRI, is being used to localize a tumor and treat our patient. It is likely after the operation has been performed, the patient will have further radiation treatments to the brain in an attempt to control any potential for recurrence. Let's review some of the anatomy and imaging techniques presented in this Part 4 presentation. Make sure you have your anatomy atlas available. Number 1, give 4 examples of how ultrasound is used to image the body. Number 2, where is Morrison's pouch? Number 3, what is a Mechel's diverticulum? How large is it? Where is it usually located? What types of mucosa are usually found in it? What is a Mechel Scan? Number 4, what is a transthoracic echo? Number 5, what is a transesophageal echo? Number 6, which type of echocardiography is most sensitive to view the heart valves? Number 7, what is a bone scan? What is the chemical used in the bone scan? Number 8, what is a HIDA scan? Number 9, what is a Mechel scan and what does it specifically look for, i.e. what complications can occur from a Mechel's diverticulum? Number 10, what is a PET scan? What chemical is used in a PET scan? Number 11, what is thermography? Number 12, what is gamma knife therapy? Number 13, what is proton therapy? Number 14, what does stenosis mean? What is atherosclerosis? What is Doppler imaging?